Hello, I'm Dr. Clint Sexton, and today I'm going to talk about functional medicine and how it relates to what we call the root cause or the root cause of health issues. So I have a little diagram here that I'll be using and referring to, and I'll just kind of walk through this to help explain to you how I look at a health issue and ultimately arrive at a solution for that problem. So if we look here, at the top, we need to identify the problem, okay? So when we go from identifying the problem to defining the problem, okay? So what that means is I need to understand what you're experiencing. I need to understand the nature of what's bothering you, because that is the problem, okay? So we'll go through this in a couple ways, but the problem is not the same thing as the cause of the problem, all right? So we define the problem. And then as we go further here, then it's gaining a better understanding of the problem. So let's say we're talking about a digestive issue. So we have to understand the digestive system. We have to understand the kinds of things that can go wrong in that area. Otherwise, we're not going to have really any understanding of what's occurring. All we're going to understand are the symptoms, such as maybe you have gas and bloating, or maybe you have some stomach pain, but that's a leap from actually understanding that area of the body and the various things that can go wrong in that area of the body. So this goes down to understanding the problem and understanding the things that can go wrong in that area, or understanding the systems, other systems in the body outside the digestive system that can affect that area that you're having problems with. Now we get down here to identify root causes. So the way we would identify root causes is we have to investigate. We have to collect information. We need to get some data about what's happening inside your body. And this is where a lot of the functional medicine testing comes in, as well as the consultations that we perform here. So what we're doing is we're trying to sort out, okay, there's many things that could be causing the issue. We could have many possible root causes, but we want to try to isolate objectively what those things might be. So let's say if we're having a digestive problem, maybe it's because we have too many yeast in the bowel, or maybe because we have too many bacteria living in the small intestine instead of the large intestine. Your bacteria should be down in the large intestine and not in the small intestine. Or maybe you're not producing enough stomach acid, or maybe you're not producing digestive enzymes, or maybe we have a sluggish action or motility of the digestive system itself, and then we start looking at the nervous system and how that affects the gut. So there's many different variables, and any and all of these could cause symptoms of gas or bloating or digestive discomfort. So this is really the key part we're really looking at here with functional medicine, is identifying, okay, root cause. Then the next step is we have to come up with what's called a corrective action, okay? So once we understand the nature of the problem, we have that part. We then identify the underlying factors, or the root causes in terms of what's causing the problem. Then we need to develop a plan or a strategy or correction steps to reverse the dysfunction that we found. So this root cause that we find, let's say that it's a problem with yeast in the bowel. Well, then we need to develop a plan to not only handle the issue of the excess yeast, but we need to change the nature of how the gut is functioning and the environment of the gut, so the problem doesn't just keep returning. Otherwise, you can kill off yeast, and if the environment suits them, they're just going to come right back again, all right? Then the last step here is we want to monitor the system, which means we want to check and make sure that the actions we took did what we had hoped they would do. So maybe you feel better, and that's great, or maybe we need to go back and recheck and see, hey, do we still have too many yeast in there or too many bacteria living in the small bowel? So it's this whole process of understanding the problem, understanding the systems involved that can affect that area you're having a problem with, then knowing what kind of testing or what kind of questions to ask to identify the root cause or causes that are creating the problem, then develop a plan to fix the things that you find, fix those root causes, and then ultimately check and confirm that the problem has been solved and we've achieved stability in the area. So hopefully that gives you a better understanding of root cause and how we look at root cause in functional medicine. If you'd like some more information on this, check out the blog.